New South Wales overnight, we did have an excess of 12,000 tests, which is good. We're getting that testing rate up. And we had 5 new cases of community transmission, all of which are linked to existing clusters. We also had 5 cases in hotel quarantine. In relation to the cases of community transmission, 4 were linked to that new cluster around the private clinic, and 1 Health believes is an old case linked to Liverpool Hospital, but it's believed the infection was acquired back in August, and so that person is no longer infectious, yet the disease was picked up in them. And Dr. Chant will give a more detailed briefing on those matters. We are urging everybody to keep updated on the Health website. Make sure you follow the instructions. This morning there were additional venues and locations put there for the community to respond to. And we're asking everybody with the mildest of symptoms to come forward. We certainly don't want to see these clusters grow. Importantly, 4 that were identified overnight in relation to the private clinic, 3 of those are in 1 household, which is of some comfort given that it's not multiple sources at this stage. But obviously we're concerned because, as you see on the list of venues, they are across a wide range of suburbs. And we need to make sure that geographically everybody in those areas, everybody in those suburbs, even if they haven't been to any of those locations listed, there is always a chance the virus can still be lurking in those communities. So we're urging anybody in those suburbs where there is also infectious cases have been to make sure you get tested even if you have the mildest symptoms. Dr. Chant will also update us on a cargo ship which came via Brisbane, which did have some infectious crew, and Dr. Chant will give an update on that, but they are isolated and I understand are still on the ship unless there's been any update, which Dr. Chant will give. I also wanted to today in particular welcome the Treasurer and the Health Minister. We're here at the wonderful institution of the RPA, and I'm pleased to announce the government will start construction of the new upgrade here at RPA a year ahead of schedule. And obviously during COVID this is great news, not just for health and world-class health services, but also to make sure we get those jobs going on the ground as well. It's a $750 million investment, which is not insignificant, but importantly will be commencing earlier than anticipated, and that will get the hospital facilities upgraded sooner, but also make sure we get those jobs on the ground. So I'll ask Dr. Chant to give the health update, the Treasurer will say words, and the Minister, and then happy to take any questions. Dr. Chant.
Thank you, Premier. So as the Premier indicated, that we've had 12,868 tests reported in the 24-hour reporting period, and we've reported 10 new cases. 5 are returned travellers from in hotel quarantine and 5 were locally acquired, and were all linked to a known case or cluster. 4 of the new locally acquired cases reported today are associated with the private health clinic cluster. 3 of these are household contacts of a case reported yesterday, and the 4th is a co-worker of the case reported yesterday. And there's now 7 cases associated with this cluster, and investigations into its source are ongoing. 1 of today's locally acquired cases is included in the total numbers for New South Wales, but all indications are that it's an old case and was most likely acquired when the virus was circulating in low levels in southwestern Sydney around August, and we believe that this case was associated with the Liverpool Hospital cluster. New South Wales is working with the Monopole restaurant in Potts Point to assess the risk to patrons and staff who may have been exposed to COVID when a person who was infectious visited there from 6 to 8 p.m. on the evening of Sunday, October 4th. Contact tracing is underway, and New South Wales Health will contact close and casual contacts directly, but anyone who was at this venue that evening should monitor for symptoms and get tested immediately if they develop. And after testing, they must remain in isolation until a negative test result. Obviously, we will contact casual and close contacts and give them specific information. New South Wales Health has also issued additional advice to people on a number of public transport routes, and these reflect where people have travelled. And these are deemed casual contacts, and people who have travelled on these train routes are advised to monitor for symptoms and get tested immediately if they develop. So it's a train from Parramatta at 14:41 arriving at Town Hall on 15:31 on the 4th of October. The train from Town Hall at 17:29, arriving at King's Cross at 17:50 on the 4th of October. The train from Artarmon at 23:18, arriving at Central at 23:48 on the 5th of October. And a bus replacement from Central at 23:48, arriving at Strathfield on 001:15 on the 5th of October. A train from Strathfield at 00:15, arriving at Parramatta on 0:45 on the 5th of October. A bus 5:50 from Epping Station, Beecroft Stand D at 17:08 to Smith Street after Phillip Street, Parramatta on 17:41 on the 6th of October. A train from Mossvale leaving at 4:04:52, arriving in Liverpool at 7:09 on the 6th of October. A train from Liverpool at 16:58, arriving at Mossvale at 19:12 on the 6th of October, and a train from Mossvale on 04:51, arriving at Liverpool at 07:08 on the 7th of October, and a train from Campbelltown at 13:31, arriving at Mossvale at 15:50 on the 7th of October. And I want to also acknowledge the support of Transport for New South Wales in providing and assisting us with Opal card data as well, and helping us resolve the dates and times of travel. That's very of great assistance in giving this precise information to the community. I would also like to just update you about the ship. So there was a ship that departed Brisbane and arrived at the port of Newcastle, and it had international mariners on board. There were 14 crew that were swabbed yesterday and had tests confirmed to be positive. One of those, just to clarify, there were 14 crew that were tested on that ship who arrived in the Newcastle port, and one of those tests was positive. It was initially thought that that test result was reflecting an old infection, but further testing has had to be underway because the test results are still inconclusive. So the ship is additional people on the ship are being swabbed today. An additional 7 crew are being tested, and there is repeat testing being conducted. I should stress that no one is at risk from this in the general community. The ship and the crew remain docked at Newcastle. No one, apart from one patient overnight that was just removed for additional testing, has left the ship, and that situation will remain, and we're working quickly with all of the authorities to resolve the outcome for the ship. But as you can understand, we need to be thorough in completing that additional testing.